The role of hormone replacement therapy in breast cancer and other female, more specific cancers. Hi there, my name is Dr. Walter Lemo, naturopathic physician with a practice solely focused in cancer care for over 20 years. Um, there's two papers that come to mind. One of them that was specifically looking at breast cancer. So these are breast cancer survivors, and they were looking at what is the current evidence on hormone replacement therapy in those population groups. So as it stands currently, even those who've had a history of hormone-positive breast cancer, the evidence still suggests that there could be some concerns of reoccurrence. And but yet at the same time, they were talking about the importance in some populations to addressing these menopausal symptoms because they could be a significant detriment to their quality of life. In those who are hormone negatives, the evidence doesn't suggest that there's current harm. And again, the vaginal estrogens, most are agreeing that they're quite safe because of limited absorption. And then what's interesting in one of these papers that testosterone replacement, was something that appeared to be a bit more debatable in terms of perhaps there's lesser controversy with the use of testosterone replacement, which I found that a bit, interesting. So having said that, yes, we know there's definitely groups of women, including, patients that I've treated, that we have walked this path of prescribing hormone replacement in hormone positive populations just because it was just being without them really impacted them quite negatively. And so I think, like anything, the guidelines are conservative, but there's always, I think, exceptions in certain individual cases. And then there's another paper that was published from Japan where they were looking at a group of more female-based cancers. So these were, for example, cervical cancer, endometrial cancer, ovarian cancer, and this looked at breast cancer as well. It was another recent paper. So just reading from the screen here. So with cervical cancer, hormone replacement is not contraindicated. And endometrial cancers, also hormone replacement was not contraindicated in stage 1 and 2 patients. Less, I guess, known in more advanced cases. And then they set a group with these types of sarcomas, uterine sarcomas, they felt, because some of them have hormone expression, that maybe you should watch it in that group. In ovarian cancers, they weren't contraindicated, and they across all stages. The only group that they maybe talked about in these lower risk serous groups, that because they are younger populations who have them, they can have hormone expressions on the tumors, that they thought, well, maybe as a precaution, watch that group. And then obviously, but they also mentioned, because of potential higher risk of clot formations, that maybe the use of hormone replacement on the skin could be a lower risk of clot formation. So anyways, there's a kind of the review amongst like all these kinds of cancers. And so again, these are general guidelines. The guidelines are conservative. Yes, I've definitely seen groups of patients who've successfully, so far so good, for many, many years, have been incorporating hormone replacement, even in breast cancer, hormone positive, and have a great quality of life and no signs of reoccurrence. But, these have to be customized to every person. But as it says, the current guidelines as of now, 2026 we're in, that that's kind of what is more, I guess, safely recommended at this point in time.